I'll be doing my presentation on chronic renal failure. So, just to start with the pathophysiology, chronic renal failure, which is commonly known as chronic kidney disease, begins with some form of kidney injury, which can be kidney injury due to diabetes, hypertension, or inflammation of the glomeruli. This eventually leads to damage of the glomeruli and the tubules with a progressive loss of kidney function. Since the glomeruli are the filtering units of the kidneys and help remove waste, this leads to a buildup of waste products in the blood, as well as fluid and electrolyte imbalance. According to Norris, from the pathophysiology textbook, chronic kidney disease is defined as either kidney damage or a GFR, which is the glomerular filtration rate, less than 60 for 3 months or longer. A decrease in the GFR directly corresponds to a decrease in functional nephrons. When nephrons become damaged, the remainder of functional ones attempt to compensate for the decreased function, leading to hyperfiltration. And with this increased workload of those nephrons, it causes them to enlarge. This compensation mechanism helps at first, but ends up accelerating the progression of chronic renal failure and eventually leads to scarring of the glomeruli, causing more progressive nephron loss. The renin-angiotensin-aldosterone system also tends to be overactivated during chronic renal failure, causing vasoconstriction, which leads to increased glomerular pressure, promoting sodium and water retention, potentially worsening blood pressure and causing inflammation and fibrosis of the kidneys. Next is transmission and causes of chronic renal failure. So chronic renal failure is not contagious and cannot be transmitted from person to person by any sort of contact. It develops due to underlying conditions and risk factors that lead to progressive decline of kidney function. According to Norris, chronic kidney disease can result from a number of conditions that cause permanent loss of nephrons, including diabetes, hypertension, lupus, and polycystic kidney disease, which is an inherited and genetic condition, with hypertension and diabetes being the leading causes of chronic renal failure. So since those are the two leading causes, just to go over them in a little more detail, hypertension puts increased stress and pressure on the kidney's filtering unit, which causes damage and reduced filtration rate. So you're not getting rid of those waste products in the blood. With diabetes mellitus, the elevated blood sugar causes damage to the blood vessels in your kidneys that assist with filtration. These vessels become narrow and clogged. Other risk factors include smoking, obesity, older age, ethnicity, and it is more common in African Americans, Hispanics, and Native Americans, as well as family history and frequent use of medications that may cause kidney damage. For example, NSAIDs such as Aleve or Motrin, opioids, medications from the statin family to control cholesterol, and certain antibiotic groups such as aminoglycosides. For priority nursing diagnoses, the first one I've listed is impaired renal function related to decreased glomerular filtration rate, as evidenced by reduced GFR, elevated blood pressure, and protein in the urine. 3 interventions I would include would be to obtain a thorough medical history and medication regimen, just because some of those risk factors mentioned before, such as consistent use of certain medications that can cause kidney damage, will need to be noted, as well as a thorough medical history to make sure if there's any history of diabetes, hypertension, family history, anything like that. And perform laboratory tests to monitor GFR and electrolyte levels consistently, as well as educate the individual on proper nutrition, such as increasing fiber, decreasing protein, and avoiding potassium-rich foods. The second nursing diagnosis is fluid volume excess related to impaired kidney function and sodium and water retention, as evidenced by altered mental status, edema, weight gain, elevated blood pressure, and oliguria. The interventions I've included for this is to monitor the individual's weight daily to note any significant changes. This should be performed using the same scale at the same time of day, as well as the patient wearing the same outfit, just to get the most accurate results. Maintain fluid restriction as ordered by the provider, noting all sources of fluids such as oral or IV fluids. Administer medications as prescribed, such as diuretics, to help promote urine output and decrease fluid retention, and assess urine characteristics as well, such as color, smell, and if it's cloudy or anything along those lines. The third and final nursing diagnosis I've included is electrolyte imbalance related to kidney dysfunction, as evidenced by elevated potassium and magnesium levels and decreased sodium and calcium levels, muscle weakness, and abnormal heart rhythms. 3 priority interventions for this nursing diagnosis will be to monitor lab values, especially electrolytes, to track progression of renal disease, and administer medications as prescribed, such as a supplement to correct decreased levels or loop diuretics to help lower potassium, since hyperkalemia is common. Perform an EKG and monitor vitals continuously, since electrolyte balance, especially potassium and magnesium, can cause dangerous arrhythmias in patients, as well as monitor individuals' neurological status and observe for confusion, muscle twitching, and seizures, or any signs, just to put them on seizure precautions if needed. For the treatment plan, it is important to note that damage that has occurred from chronic renal failure is often irreversible. According to the Mayo Clinic, treatment is focused around controlling symptoms, reducing complications, and slowing the progression of the disease. To reduce complications, some treatment options include administering medications to help reduce worsening hypertension or help manage blood pressure, such as ACE inhibitors like captopril, or ARBs such as losartan, because these also are medications that do protect kidney function. Another one is administer medications to help reduce fluid retention and get rid of excess potassium, such as furosemide, which is a loop diuretic, or thiazide diuretics. Phosphate binders may be prescribed to assist with elevated phosphorus levels in the blood, and so it will just be important to administer those as prescribed. Calcium and vitamin D supplements may be used to help correct hypocalcemia and reduce the risk of fractures for those with chronic renal failure, especially since older age is a risk factor as well. Consulting with a dietitian to confirm proper dietary needs and assist with educating the patient on those dietary needs will be important, as well as collaborating with a nephrologist, since that will be a specialized diagnosis for the management of the renal failure. If kidneys become severely damaged, dialysis may be needed to remove waste products and fluids for the patient. And education on lifestyle changes is important to help reduce complications, such as smoking cessation if the individual does smoke, daily exercise, and weight management. Monitor lab values, urinary output trends, and characteristics, and vital signs frequently will be another important aspect to the treatment plan. So for nursing care impact on outcomes, it is important to note that nursing care plays a critical role in improving patient outcomes with chronic renal failure. As part of the healthcare team, we play a key role in monitoring signs and symptoms that may indicate complications. Since we're by the patient's side, majority of the time, we're able to perform timely interventions to reduce the risk of further complications, as well as be an advocate for a patient. So to go into some detail, the National Library of Medicine states that the prevalence of depression is about 3 times higher in patients with chronic kidney disease than the general population. Therefore, providing emotional support and encouraging positive coping mechanisms will be important. Early detection and continuous monitoring can allow the healthcare team to adjust the care plan as needed to help slow the progression of the disease. This can also allow us to detect fluid retention, electrolyte imbalances, and worsening kidney function early to take the necessary steps. Thorough education on what renal failure is helps promote patient involvement. This can increase the likelihood of adherence to medication regimens, maintaining proper nutrition, and adhering to dietary restrictions, as well as keeping up with follow-up appointments. Collaboration will be especially important. This may include collaborating with a nephrologist, a dietitian, social worker, and potentially a psychiatrist to allow a specialized diagnosis and care plan for us to follow, minimizing risk of complications and non-compliance. And management of symptoms is something that we play a key role in as nurses, such as nausea, fatigue, swelling, shortness of breath, muscle weakness, and others. And management of these can help improve quality of life as well as reduce the number of hospitalizations for individuals with chronic renal failure. So 2 questions I have is, how do lifestyle changes such as following strict dietary guidelines and weight management impact the progression of chronic renal failure? And how do healthcare disparities impact access to treatment for individuals with chronic renal failure? That is all. Thank you, everyone. And my references are listed here.